Go there now live.
But I was amazed by what I saw there, the amount of abuse that is happening. What is the minister saying about the borders that are porous? And in the policy of the government, it says that you must never chase the patient away from the hospital or from the clinic. And I used to see a lot of people coming in there for lots of things that are coming from all corners of the world. I don't want to sound like xenophobic, but because of the problems of the thing. So that's one thing. The second thing then
okay, William, we'll come back to you just now. Just stay on the line. We reconnect with our viewers on SABC News Channel 404. Thank you very much for rejoining us. A lot of questions have been raised here. Minister, there's a call about Matatini Hospital. There's an issue of porous borders. You hear also the issue of what do I stop my medical aid now? Shortage of doctors, and maybe why not deal with the issue of medical students and so on and so on. Perhaps let's just go on and respond to some of those issues before I go to Dr. Sbongiseni Dlomo.
Thank you very much. A number of questions. What happens to the nurses in hospitals with NHI? The NHI is going to rely on the existing professionals. That cadre of professionals that are running health service are going to be the base on which we build NHI, both public and private, and we just need to arrange, particularly with the private, on how we relate with all of them. And the issue of, from Dr. Brink, there's no NHI yet. We're discussing how to structure it. So what happened was the pilots that were being put up to look at what weaknesses need to be corrected. So anything that pilot showed is what we need to correct. It doesn't mean that the NHI is a failure. So I think we're misunderstanding what we're trying to do. We want to go and find out some of the weaknesses and correct them. Same with the Office of Health Standards Compliance. It actually been on a trial run. It's nothing official yet, but it was to try and say how should it go around assessing the hospitals, what parameters need to be put in place, and it's going to be an issue that we're going to be building upon, so that the numbers of hospitals that are compliant are going to be improving as we institute the quality improvement training program. That's what's going to change the situation. The challenges of the Auditor General are issues that are fundamental to us reorganizing and restructuring our management of hospitals, together with the issues of corruption. So the questions that have been raised about the use of the clinic committees, hospital boards, I think those issues are very important, because our people must have a direct say to how the hospital is run, and therefore hold local management accountable. The question was raised about someone who's on dialysis. Firstly, don't do anything to your medical aid. They were not changing anything yet. When we come to talk about what changes are coming, it will be after 2026 when we start talking about, these are the packages of what we make available and so on. Obviously, the issue of dialysis, as I was saying earlier, non-communicable diseases are going to be one of the major burdens that we're going to have to face. And so there will be a cover on that one. We're going to be having a team that will look into the health benefits to give us a sense as to how we're going to manage that whole area. But I don't want anybody to start interfering with what they have right now. Then the other points that have been raised, the challenges in the hospitals, we're aware of those, and we're working on a program to turn those around. And that's why we're saying we are going to do the two things together, to say this is what NHI needs, and therefore we set the standards. At the same time, we go and transform the hospitals and change the situation as it were. Tutuzo raises the issue about the question of procurement. I think we just need to be alerted onto some of the weaknesses that we must avoid. But one of the advantages of the NHI is that it sets the prices. So a lot of stuff, you're not going to come here with prices that you have figured yourself on your own. You are going to actually comply to the prices that the NHI is prepared to pay. What NHI is not prepared to pay, will not get services from those. Then the issue of the doctors who are qualified from outside. Yes, we have actually placed an extra 847 new interns this year, next year, on top of what we used to do. So it's close to 2,000 something that we have in place. So we are placing a lot of interns, more than what happened before. We are also now looking at those that qualified from outside and those who are foreigners. We have actually a matter that we're taking to court now to look at various placement programs for people to go through internship. So that's what we're going through. The traditional healers are part of the health system. However, because as I think Kululego has rightly pointed out, they are playing on the public space, on the private space. So effectively, we will work on the mechanism of accrediting them so that we can avoid charlatans in this whole area. But then we're going to train them so that there are certain things that they must be able to assist us with. HIV issues, blood pressures. They need to be able to understand some of the basic things that we need to treat early so that they can refer early, and there must be a good working relationship. But they form what we call the community wellness program, together with the other complementary health services, acupuncture, homeopathy, and so on. So that's going to be a broad area of community wellness programs. Then the issue of the NHI being a lifeline to a private sector, what people are not aware is that the private medical schemes are going to crash if we don't do anything about it. Yeah. So part of what will help is the issue of reorganizing at the level that we're raising. Yes,
the biggest looting scheme.
That's why I said that the question of procurement, there are a few things. Firstly, we're saying that the fight against corruption is going to be based on this health sector anti-corruption forum that's going to investigate all sorts of things and prevent corruption from taking place. But at the same time, the NHI is going to be based on a pricing committee that will determine the prices. So no one will come and exploit NHI. There'll be set prices. You work with NHI on the basis of the numbers of patients you treat and the conditions that are going to be covered, as well as the prices. If you don't agree to that, then you're not going to be contracted. Okay. So that will help. The last point is around the porous borders. Yes, indeed, this is a real challenge, and this is happening in many countries where you find that people just walk into the hospital. But in terms of the NHI, our approach is that the people who will qualify for national health insurance are those who are South Africans, those with residence permit, and those who are proven as refugees with confirmed asylum status. Anyone else who is not in that system, because everyone is going to be going through on the basis of being accredited in the system as a beneficiary. Those who are not can only qualify for emergency care, emergency services, or treatment for preventable for notifiable diseases, Ebola and those kinds of diseases, so that we contain them. But anyone else will not necessarily qualify to be part of the NHI.
Let me bring in Dr. Sibongiseni Dlomo here. I mean, the issue of Matadeni Hospital, you and MEC in KZN, you know that hospital very well. You come from around that vicinity as well. Just talk to us about such issues. Is it RH Khan in Phoenix? Those are some of the issues that we come across all the time. How does the portfolio committee look at these issues and begin to address them?
No, we are happy that in all these public hearings that we go through, the Department of Health is always represented nationally and provincially. And we welcome the comments by the minister that, the road is NHI, but let's fix as we go along. So the fixing that is taking place, both at Matadeni, Newcastle, whichever hospitals we have gone to, we, in fact, are expecting to get the portfolio committee members calling upon the departments to come to present, to say, while we're doing public hearings, we listen to this and that story in Springbok. What's your take on that? What is your response on that? But so that we welcome. And if the minister could continue to give confidence to South Africans as to how they are planning to do the fixing as we go along. But quickly, Bongi, if you could allow me to add 3 other points.
Yes.
One, we did not want to dismiss the noise that was there as a portfolio committee with regards to the constitutionality of this bill. And so I wrote to the state law advisor before we started the public hearings. She wrote back, and I also received, I brought her to Parliament to actually come and help us as portfolio committee to go through that letter. And there was no noise thereafter to say, and all members of the portfolio committee were satisfied that this process, not that I didn't believe Dr. Mkhize when he said this thing served in cabinet, but we wanted as a portfolio committee also to get our own acts together to say, as we start public hearings, where are we in terms of this constitutionality being challenged? The third point is that the law process that is happening in our country is so democratic. Whether we get a hall with 800 people or with 1,000, but we are going to have 36 meetings in the whole country, in all provinces, and we welcome even about close to 100,000 comments that are already sitting in Cape Town that we are going to go through into it. But the last point, Bongi, is that in October we were visited by a group of elders led by former Prime Minister of Norway and also the former President of Chile. And they say, look, probably this is something new in South Africa, but the universal health coverage is not new in the world. You have probably done well as South Africa on this and that, but you seem to have lagged behind in terms of doing issues on focusing on health. And their statement, which really sank with us very strongly, was they say, in quote, the health revolution that actually is going to come with universal health coverage in this country we call NHI is going to significantly improve the GDP of our country. Among other things, it's going to improve the life expectancy. So there's a lot of spin-offs. And the comfort that we have is that the department is bringing a bill to us which has been tested in other countries. And therefore, there's a lot to learn. And I would really plead with South Africans to say, let us go there and learn from those countries. Because there's nothing, we're not starting something extremely new. Probably it's new for South Africa, but it's not new in the world.
Thank you very much. That's Dr. Sibongiseni Dlomo there. Anban Pillay from the department, DDG there. Maybe just in 30 seconds, 45 seconds, a wrap from you.
I think many of the quality issues that are facing the public sector are addressed in the Presidential Health Compact, where you'll see we address the issue of human resources, the availability of medicines, the quality of services in our facilities, leadership, governance, etc. So if you look through that Health Compact, you'll see a range of activities, targets, dates, etc., which we intend to achieve in order for us to turn the health system around so that we can build confidence about the quality.
Thank you very much, Anban Pillay there. Minister, let's wrap up then. We have 2 minutes to wrap up. You have come, you've listened, you've engaged. What is your takeaway from here?
I think we need to continue these kinds of engagements. They are very informative. It also opens up a space for us to close the gap amongst us. I think we also need to realize that this issue of national health insurance is not just about health. It's actually a country program. It's spearheaded by the president the whole world over. That's the way it works. And in this case, we are focusing on what it will do to improve to create a healthier population and also to ensure that we can invest on human capital. That's what's going to build the economy of the country. And as Dr. Dlomo was indicating, South Africa is one of the 5 countries that are responsible for 50% of the deaths of people in the continent. We need to change that. And so there's no such a thing as the economy cannot afford. We're saying that for the economy to grow, you must start investing in the equality in health, equal access to health services. And that for us is what this is all about. The issue of constitutionality, we've actually raised that it's actually, at the moment, it's non-existent, and we have not got a convincing argument. It is true that we've been visited by elders, and many countries have actually moved in this particular area. In fact, for the African Union, President of Rwanda, President Kagame, has been asked to be the champion of ensuring that there is adequate financing of health by the public sector to be able to ensure that we've got universal health coverage. The WHO has actually insisted that all the countries must move in this direction. G20, the same thing. United Nations has done, as I said, the same issue. So we actually need to move on as South Africans. The idea that if you've got corruption, then we must not aspire for the best health services, I think it's something that we need to solve and move ahead. As far as we're concerned, the NHI is the way, NHI is the future, and South Africans will plead with all South Africans to support national health insurance.
To all our SABC Channel 404 viewers, SABC News Channel 404 viewers, thank you very much for tuning in. Thank you very much, Minister, and to you, the beautiful audience, and to you at home on 0891 104 207. We thank you very much for that, and the comments that you've sent, the WhatsApp voice notes, and the SMSs and tweets. We couldn't engage with all of them, but that's where we leave it for today. We will continue with this conversation some other time.